In this video, we're going to discuss the post-op diet, or the diet that you will follow after surgery. The instructions that you will hear will take you from post-op day 1 through post-op day 20. I think starting out, it's important to understand why do you have to follow the post-op diet. First off, it's dangerous and it can be life-threatening to not follow the post-operative diet. The diet progression is important to help your stomach heal properly and to avoid surgical complications. It will ensure that you have a long-term successful weight loss, and it will allow proper healing. As you move slowly from clear liquids to pureed foods, it matches your body's natural tissue repair timeline. So you're following what your body needs you to do to heal properly. A little something to keep in mind is as we move forward and we're going to talk about post-op day number whatever. So I want you to remember that the day you have surgery is day of surgery or post-op day 0. Then moving forward, the day after your surgery is considered post-op day 1. The next day is post-op day 2. The next day is post-op day 3, and such forth. So just remember that as we're talking and moving forward with instructions. On the day of surgery, you will be nothing by mouth. That means nothing to drink, nothing to eat, and no medications. Now, the hospital will give you some medications by mouth, and that is okay. You will be getting IV fluids. They'll be infusing all throughout your stay. That will help keep you hydrated. And then lastly, the hospital will provide mouth swabs and some water. That will help keep your mouth moist. Just letting you know that you may or you may not have an upper GI on post-op day 1. That will be up to your surgeon. But once your bariatric team decides you are ready for fluids, they will be there to get you started drinking. They will start you on clear liquids and they'll give you guidance on how much and how often to drink. But remember, it's always going to be small, slow sips. So on post-op day 1 and post-op day 2, you'll be what's called phase 1. This is clear liquids only, and all clear liquids need to be non-carbonated, caffeine-free, and sugar-free. Electrolyte drinks such as Gatorade Zero, Propel, Powerade Zero, they are strongly encouraged, which will also help keep you hydrated. You'll want to drink your fluids frequently throughout the day, but it's also going to be small, slow sips. So you'll need to wake up early and drink all throughout the day. Your goal will be 48 to 64 ounces of clear liquids daily. You will be provided small medicine cups in the hospital. They are 1-ounce cups. You'll want to use these and you'll want to set a goal of 1 ounce every 10 to 15 minutes. Please see your handouts from class on page 4 of your clear liquid options, and you can also view the hydration educational video on YouTube. All right, so now we're moving on to post-op day 3 and 4, and this is when you'll add your protein shakes. So first, before adding protein shakes, though, you must be reaching your fluid goal of 48 to 64 ounces of clear liquid daily. If you are struggling to reach that goal, now is the time to give the office a call. We'll get you in touch with a nurse or a dietitian. They'll give you some tips and tricks to help you reach your goal. But once you reach your fluid goal and you are confident that you've got that, then add 2 protein shakes per day. Now, looking at protein shakes, it is going to be somewhere between 21 and 23 grams of protein per scoop. Your goal of protein is 60 grams of protein per day. So if you are someone that makes your shakes with skim milk or 1% milk, then you get to add 8 grams of protein to that 21 or 23 grams. So you'll be getting somewhere between 29 and 31 grams of protein per shake. So once you have 2 shakes per day, you'll be reaching your goal of 60 grams of protein. Now, if you're someone that makes your shakes with water alone, then you are only getting that 21 to 23 grams of protein per shake. And with 2 of them, you're getting somewhere between 46 and 52. So what we need to do is increase your protein. And an easy way to do that is adding a protein water. Now, protein waters are the only things that get to count towards your protein goal and your fluid goal. Some examples of protein waters are Protein 2O. There is a brand called Clean Simple Eats Clear Protein. The only thing you can't do is use the energy drinks. And then there's one called Premier Protein Clear. We also have other brands that you can ask the office for a more comprehensive list. But remember, if you add a protein water, then that gets to count towards your fluid goal and your protein goal. Now, on post-op day 5 is when you get to add your pureed foods. Please remember, you get to add pureed foods only when you are reaching your fluid goal of 48 to 64 ounces a day, and you're getting your 2 protein shakes or 60 grams of protein per day. Then you get to add up to 1/4 cup pureed food 3 to 4 times a day. The pureed texture is for your safety after surgery as your stomach is healing. Thawing out prepared food is the best way to do it. So a good little tip is to puree foods such as maybe canned peaches, canned pears, canned carrots, or canned green beans. Freeze them in an ice cube tray. Each little cube then is about 1 ounce or 1/8 cup of pureed foods. So 2 cubes would be a serving. So we talk a lot about ounces and 1/4 cup and all that. So I just wanted to remind you that 2 ounces equals 1/4 cup. This list here are examples of pureed foods and full liquids. The list on the left are foods that are allowed as is, and the list on the right are foods that need to be pureed. So on the foods that are allowed as is, sometimes having these around the house after surgery just makes it a little easier for when it's time to eat, you don't have to prepare anything. So things such as yogurt with no fruit pieces. You can even do Greek yogurt after surgery. Reduced fat or fat-free ricotta cheese, sugar-free pudding, unsweetened applesauce. A little idea is canned 100% pumpkin puree. Some people like to put a little stevia and a little cinnamon in that. Plain instant mashed potatoes or homemade mashed potatoes, but these have to be with no butter and no store-bought, such as no Bob Evans or no KFC. Remember, this has to be made from home. Plain cream of wheat or grits that are thinned with water or milk is another easy one. Some ideas for foods that can be pureed that are great ideas on the post-op diet are low-fat or fat-free yogurt with fruit pieces. Remember, if there's fruit in there, it does have to be pureed, and that again is Greek or regular yogurt. Condensed soups, but no noodles and no rice. And if there's any pieces of chicken in there, remember, it has to be pureed. Low-fat or fat-free cottage cheese. Even though you've got small curd, it does need to be pureed in a blender. Plain oatmeal thinned with milk or water, as long as you are blending it and pureeing it. A good idea is a chicken salad or or a tuna salad. This is something that you could add some low-fat mayonnaise, a little bit of mustard, some pickle juice. Remember, no pickles, no relish, no produce, no nuts. But the other things, the canned chicken, canned tuna, the ones that are in water, low-fat mayonnaise, mustard, pickle juice. Blend that up and you have a nice chicken salad or tuna salad. Another idea is fat-free refried beans. You can take some fat-free chicken broth, put that in there and thin it. It's a great pureed food. Remember, if there's chunks of beans in there, though, you must puree it. Canned green beans, canned carrots, canned peaches, or canned pears. Remember, this list that I just reviewed all must be pureed. So now, how do you puree foods? You'll need some type of kitchen tool such as a blender or a food processor. You'll put your food into the blender, start to blend it, and then slowly add some type of agent to moisten the food. So something like light mayonnaise or mustard, low-fat milk or low-fat gravy. You can use low-fat bouillon or broth, pickle juice or relish juice, but again, no pickles. As you move forward and you're thinking about what foods you're going to eat, there are some guidelines to follow. You'll want to follow low fat and sugar guidelines as follows. The fat, it has to be 5 grams or less per serving. Sugar needs to be 10 grams or less per serving. So on the nutritional label on this slide, you can see the total fat is 0 grams and the total sugars is 0 grams. And just so you know, these are canned green beans. Please keep in mind, these are some foods that you must avoid the first 6 weeks after surgery. Absolutely no bread, no rice, and no pasta the first 6 weeks. No fresh fruits and no fresh vegetables. Only stick with the foods that were given on the list. No grilled meats, no tough, stringy, or dry foods. No breaded, no fried, and no air-fried foods. And remember, no nuts and no seeds. Anytime you eat, you will want to strictly follow the 30-30-30 rule. So what does this mean? You'll want to stop drinking your clear liquids for 30 minutes before a meal. You'll want to set a timer because, you know, when you're busy doing things, you might lose track of time. So set a timer for 30 minutes. After that 30 minutes, you'll want to take your serving of food and you'll want to eat slowly. Your bites should be the size of a pencil eraser. You'll want to take 30 minutes to eat that meal. So very small, slow bites and stretch that meal out over 30 minutes. Then once you're finished after that 30 minutes, you'll want to wait another 30 minutes after your meal of nothing to eat or drink. Then you may start drinking your clear liquids again. This habit or this rule is recommended for lifetime. There's a video on our YouTube channel. Check that out and it will go over the 30-30-30. It'll give you a little demonstration and help you understand why it's important to follow this rule. On the Monday after your surgery is when you'll start your multivitamin. You will take 1 Bariatric Advantage Ultra Solo pill a day, and you'll want to make sure you take this after a meal or after a protein shake. That way you have something on your stomach. You will not start the calcium soft chews until after your 6-week appointment and after your bariatric team instructs you to get those started. So let's review these guidelines. First, you're going to drink 48 to 64 ounces of clear liquids per day. Remember, your protein shakes do not count toward your fluid goal. You'll also drink 2 protein shakes per day made with 6 to 8 ounces of approved liquid. Then you will start your 1/4 cup of pureed food 3 to 4 times a day once you are reaching your fluid and your protein shake goal. And then lastly, remember, you must follow the 30-30-30 rule. I cannot stress this part enough, but if you're struggling, if you have questions, you have any concerns, give the office a call. Our phone number is 513-682-6980. During the open hours of 8 to 4, Monday through Thursday, or 8 to 3 on Friday, you may get a message, but hold on and listen to the message. We will get the phone. After hours or on the weekend, the message will walk you through to get in touch with the on-call physician. Just give us a call. We're here to help. On the Monday after your surgery, you'll get a phone call from the nurse or from a dietitian to check on your status, see how you're doing, see how you're able to get your fluids, are you able to get your protein shakes, that kind of thing. So just plan on a phone call coming in that day. If it's a holiday, it may be Tuesday, so just be aware that we will be giving you a call. Thank you for watching the video. I hope it answered some of your questions, decreased any anxiety. Also, check out some of our other videos. Have a great day.